guys. We have Dr. Rook from Brisbane, Australia. Dr. Rook, thank you for joining the podcast. Historically, there has been a lot of negative feedback coming from, patients in Australia, and patients are always told to, if you're in Australia, to go abroad, go to Thailand, go to different places in Asia to get surgery. It's exciting to see you emerging as, a young new prospect. And I have to say, I've been very impressed by your results that have been posted on the Hair Restoration Network and both on Instagram. If you can give us a little bit of background about yourself, how did you get started in the hair transplant industry?
Yep. I joined Hair Transplant in 2015, and at the time I joined a big, large company, like a corporation that had a franchise system. So when we first started, I was using manual punches and single implant pens. I was in that company for about 4 or 5 years. And in 2000, we rebranded to another company. And at that time, we had the option of using motorized punches. So up until that point, we were using only manual punches. So that then gave us the freedom to explore what other options there were in hair transplant. Because we weren't bound by those policies with the other franchise.
So somebody asked me, because obviously you've had a lot of buzz. We have a great number of Australian and New Zealand members on the forum. A lot of them are excited to see, your results. But some have asked me, like, who trained you? Were you mentored by any particular surgeon, or did you kind of just learn your own techniques when you started?
So at the time when I did the initial training, that was in India back in 2015-16, but that was their technique and their ways. So over the years, I've kind of developed my own techniques and ways of improving myself.
So you started training, you learned basically in India, not in Australia in the
Right.
beginning.
Yes.
There's actually a lot of good surgeons in India, and India
But
seems to
what I did back then compared to what I do now is completely different.
Did you
That was
start
the
with strip?
foundation for me.
Did you ever do strip, or was it strictly FUE?
Strictly a few.
So let's take a look at some of your work here, because I want to share some of your work here that I think is really impressive. This was just recently posted on the forum by Mark, one of your patients. uh, 8,470 grafts has to be a record in Australia. I don't know of any other surgeons that have done this number of grafts in, is it what, 2 sessions or surgeries?
Yeah, two days back to back.
So one surgery, 1 session, 2 days.
Yeah.
Wow. Yeah, nobody's doing that number, that scale in Australia that I know of. So that's a very, very impressive result. This one was also extremely impressive because this was like a Norbit 7 patient. Not sure if you put his age,
He
but
would have been at the time about 25.
wow, 25. Very extreme
So that was
level
a
of hair loss.
1 day session.
Okay, so almost 6,000 grafts in one day. Take me through your process, because not a lot of people have heard of you in the community. It's great to see you doing these sort of hard cases, these high Norwood cases that I think are necessary and pushing the boundaries. What is the normal process for you from the consultation to the surgery day?
So the consultations with me are usually done with my hair consultants or manager, and that's the initial consult, and then they have the option to see me afterwards. So I would say about 20 to 30% will want to see me for an opinion, and after they pass that process, then on the day of surgery, we spend an hour in the morning going through what the patient wants, what's possible. All of that stuff's done beforehand too, but just to reiterate what can be done. That's also done in the morning of surgery. And aim is to create something natural looking and realistic, and that's going to age appropriately with time. I hate seeing hair transplants. They continue to lose more hair in the future, and then they're left with a poor outcome. So the ideal outcome for me is creating something that looks long lasting and that looks like the normal thinning over time. Another consult's done in the morning, and then the day of surgery, it's either 1 or 2 day surgeries. That's the maximum that we do.
I guess in the process, they send you a consultation, I'm assuming either like through a form, and they send you pictures, and that'll go through Mark which is the manager. He's also a patient, which I'm going to share his results, which
Yeah.
are amazing, by the way. I guess relay the information back to you, get an
We assess
estimate
the
of how many
cases.
grafts,
Yeah.
and then send that. And then the day of surgery, you spend an hour with the patient, which is good because there's been some complaints of really good surgeons, and the biggest complaint is I felt like the initial planning was kind of rushed. Like they drew the hairline, and within a few minutes they're off to the surgery.
Mark and I have worked together for a long time. So he knows how I operate and he knows what I would recommend in terms of hairlines. We try to be a bit more conservative
Mm,
in our approach with managing patients' expectations. And if I think something is possible, then we will decide to go ahead with changing that plan.
mm.
But generally, we're a bit more conservative.
Someone's going to probably say, "Well, that case didn't look very conservative." That the 25-year-old, I don't. They're probably going to that looked like a pretty aggressive. And when you say conservative, I think you're meaning more of just with the hairline
Hairline,
placement,
yeah,
not in terms of like taking on like a young patient with aggressive hair loss.
that's correct. Yep. In terms of hairline design, we remain conservative.
And let me share Mark's results here. This is what his hairline looks like now, which I think is, yeah, it's a very conservative. And correct me if I'm wrong. I'm guessing Mark is going to be around my age, probably late 30s, right?
Mark is 38. Yes.
Yeah. So yeah, we're the same age. So I mean, that looks incredible. And this was 5 years ago, I think,
5
right?
years ago, and that's manual FUE.
This is all manual FUE.
Yeah, all manual. That one.
And wow, I mean, what size punch did you use on Mark? Because I'm trying to look. It's very hard to see. I guess it's very hard to see any signs of surgery here.
I think it was a 1 or 9.5.
Wow, really? Okay.
But the thing with punches is when you expand the skin with saline, it stretches. There's a lot of debate about punch sizes, but you have to think the skin's like a balloon. The more saline that gets pumped in superficially, the more that the skin stretches. And when you make an extraction site, it becomes a smaller hole once the saline disappears.
Just to show here, he had 5,000, almost 6,000 grafts, right?
He had 5,200, around
5,200.
that. Yeah,
I mean, the hairline looks really, really good. I think I think one thing that some people might say is does he have really thick, coarse hair?
he does. He's got a good donor, good hair.
Yeah, that's a huge difference. I mean, it's almost unbelievable the amount of density he got with 5,200 grafts.
He had a good hair ratio too.
Oh, okay. Yeah, so he had a lot of good density,
Yeah,
strong density. Yeah, it looks like he had the trifecta going for him. Really good donor density, probably a good shaped head, and really thick, dense donor where you
yeah,
could
he
extract a
did.
lot of grafts. Because let me see how many hairs he said he moved. 13,000 hairs. Wow, 13,000 hairs with 5,200 grafts. That's crazy.
For manual punch FUE, that was a good number. Nowadays we do a lot more, but now we have motorized punches.
Well, I mean, it's still 2.5 hairs per graft per follicular unit, so that's still a good ratio for that time 5 years ago. There was a lot of debate back in the day. I think probably 10 years ago,
Yeah,
and this was primarily because Dr. Lorenzo in Spain was only doing manual, and he was kind of seen as like the best at the time. And so everyone was like, oh, you got to do manual, you got to do manual. But I think now that we're seeing more motorized punches like the Trivellini and the Devois system, I don't really see any benefit of using manual over motorized, especially if you know how to use it. Give me
I've
your opinion.
yeah I've used both systems, and now I use the Devroy system. They're day and night. The Devroy is it's like far superior than manual FUE.
Wow.
The quality of the graphs that we achieve now are incredible.
I think it's just getting more refined.
It's a
You can,
different punch tip. So there's different, you can get sharp, blunt, and hybrid. The ones that we use are hybrid punch tips, which has a trumpet shape at the bottom. So the cutting edge is different to a sharp punch, and it's not continuously rotating like some of the sharp motorized punches are. With this punch, how it's designed to operate is by placing the punch on top of the skin, and then you press the foot pedal to accelerate it. So you get a nice circular excision hole, which improves scarring too of patients.
Correct me if I'm wrong. Is Mark on finasteride
Mark on finasteride.
and minoxidil?
Yes.
And how do you feel about patients who, because I'm sure you get a lot of patients who are like, yeah, Dr. Rook, to be honest with you, I don't want to take a pill. I don't want to do anything like that. I just want to get surgery. What's your process with patients
Okay.
like that?
Yeah, I try to gauge what the expectations are from getting a hair transplant and educate them on how it's a progressive genetic condition.
Hmm.
And if they're happy to go ahead, then we will consider that and go ahead. But if their expectations don't match what's going to happen in the future and they're likely to lose more hair, especially if they're a young patient, then we will try and not do surgery because I don't think it's going to be beneficial long term. But if they have a realistic outcome and are aware what's going to happen, then we may proceed. And if they don't want to take tablets, we will try and encourage them to take topical finasteride or minoxidil if they're willing to. Given the future is unlike, no, we don't know what's going to happen.
What do you feel is like the cutoff age? And I ask this to a lot of doctors because it seems like some people say 25 years or older is okay. Some surgeons are like, I take on patients that are 21. What is your cutoff age or too young of a patient that you would take on?
We don't normally take under 20. We will take patients from 20, but we do try and educate them on medications. If they're not going to take medications, we probably wouldn't do surgery because I think it's too young to have surgery at that age, especially doing big cases.
What age would you take on a patient that doesn't take medication? What would be
If
the
they
age that
have a very strong family history of hair loss, and if they're very young and they're not going to do medications, we wouldn't do surgery. I don't think it's worth it because in 10 years, they're going to have all these scars at the back of their head and have transplanted hairs only on top, and it's not going to look good. And I see patients like that walking around, and it doesn't look good.
have you gotten patients like that come to you that are in a very bad situation and how would you fix something like that?
I think just yesterday of a patient that had a hair transplant done 2 years ago, FQE, where he had large multiples, like 3 hair, 4 hair grafts in his temporal peaks.
Oh yeah. Let me go ahead and share this case. So yeah, let's talk over this case. This is a patient who had a really poor outcome. You can see there it looks like some cobblestoning, looks like poor density.
He had traction alopecia, so it's not male pattern balding, and then this was the outcome after 2 years. And since then, he's been growing his hair long and wearing it forward to hide the hair transplant. So for him, what we did was we extracted most of those large hair follicles out.
How did you repair the temple peaks? Because that's what really to me is sort of the worst thing of this case.
I
Like,
had to extract those hairs out. There were threes and fours in there.
yeah, and the angles look all just completely different angles.
Yeah. So he would have had 2 or 3 technicians putting those hairs back in.
And then this is him with his you replanted. Did you replant those
Mm,
grafts or did you?
Not the same grafts, no. So I extracted grafts from lower down near his nape region and just above the ear to get single hairs out.
And what did you do with these hairs that he had? Did you kind of redistribute those a little bit back to kind of add density, or were
Yes,
those
yeah.
just lost? Okay.
Nice. The ones I could use, I used again. Some of them get transected when you take those hairs out. They're different inside the skin when you're extracting those hairs compared to how they would normally be anatomically at the back of the head, especially in
Yeah.
the temporal peaks. They're in a
Yeah.
different angle and direction.
I was talking to Dr. Marasano of Hattingen. He was telling me that there's a big, big, big issue going on with surgeons that repair patients just might not be able to get help because A lot of the cases, a lot of surgeons, over 50% of their patients are repairs. And some of those cases, they need session punch out sessions where they
You do.
remove the grafts. A lot of the times now, this patient has become sort of this new doctor's patient. So,
Mm.
and I've seen this personally. The patient will then, if something happens, they're not happy. They're not talking about the hair mill that botched them to begin with. Now it falls on this new doctor that tried to do their best to try to fix this issue, and it's becoming sort of unmanageable for a lot of surgeons. Are you seeing that in Australia?
We get a few, but we're not getting. We might see one a month.
So it's not
We're
as
not
as
getting a flood just yet, but I feel like we will soon get a flood
yeah.
with what's happening in the market, the changes that are happening. So there's a lot of people coming on to hair transplant. So there may be more in say 12 months time.
Take me through this other case here that I think is super impressive. This looks like a patient who was a Norwood 6 diffuse, but he really doesn't have that much hair. And I mean, this looks like incredible density. Um, how, how many grafts did this take?
I think that was around 8,000 grafts. So that
8,000
would,
grafts.
yeah, that would have been one session 2 years ago of around 4,000 grafts and another session around 4,000 grafts recently. And that's 3 or 4 months after his second procedure.
So he's had in total how many grafts? 12,000?
No, 8,000 total.
8,000 total.
But
And
that
he's
was
had,
4,000, 4,000.
wow. And he's got 20,000 hairs out of 8,000. That's some
Yeah.
incredible.
I think that with the new technologies that we're using, the grafts are more intact and they're not damaged. They're less damaged than what they used to be. So they grow back really well.
What would you say your transection rate is? Like the percentage of transection?
I believe less than 5%. You always get transactions with surgery.
Yeah. Yeah, it's inevitable. Yeah.
People that say they don't get any transactions, I don't. I've been doing this longer. You get transactions depending how many grafts you do too. When you're doing these large cases, you probably get less than 5% good. I think there's partial transactions and full transactions. So you need to when you talk about transactions, what type of transactions are you talking about? So if you turn a 3 hair graft into a 2, that's still a transaction. And then
Yeah.
there's complete transaction where you completely transact the follicle. Melvin, you mentioned last time, like some of these repair cases you have to do over a few sessions because you can't extract the entire follicle in one session. And I've seen this. I've had
Yeah.
patients like that before in the past where you excise some of these grafts, ask them to come back, and then because you can't take the complete graft out, you have to do another session of extracting those hairs in the front. Sometimes we don't have that option. So, like you mentioned, patients still get regrowth of that initial surgery because they were not placed in the correct angle and direction. So,
Yeah.
repair cases do require more than one surgery.
Yeah, and a lot of the times it's because of telogen hair, like you'll extract grafts, but there's
Yeah,
there's some hairs that are
I'll be
dormant, so
resting up.
there'll be a couple of, scragglers left around. And that's really why I'm so passionate about this, because that's why I started this podcast, and I do podcasts with surgeons like you, is I want to spread awareness. Like, it's not just about the cost. Guys and girls are just looking at, okay, I'm going to go to, let's say, Turkey, but Turkey isn't the only place with this model anymore. It's worldwide. I'm going to go to this place because they're offering me whatever number grafts for $2,000.
Mhm.
And they're gonna pick me up in a limo, and they're gonna, I'm gonna stay in a 5-star hotel, and it's all about the experience and not about
Yeah,
the results.
yeah, they're
And
selling emotion,
yeah, they're just like, oh,
not the
we're
results.
come over here, we're gonna give you a good
Yeah,
price. It's really hard to get through to these people that, look, this is a surgery, this is your head. It's a medical procedure. It's not just like you're gonna
it's
go
not
shopping for
Botox.
a car. No, no, not it's even Botox I wouldn't really go
But
to
but
get.
it reverses, right? This stuff doesn't
Yeah.
reverse.
No, it's gonna stay with you, and if you can't afford surgery, don't get surgery. That's always my motto. Like, if you can only, because I've had so many guys say like, I got 1,500. Who can I go to? I'm like,
And
nobody. Put that money, buy a year's supply of finasteride. That's my recommendation.
yeah,
Don't forget about surgery, because at
yeah.
that
Like you
price
said,
point,
a bad surgery is worse than no surgery.
Absolutely. It's just it's getting really bad, It's getting really bad, especially with the social media, with that kind of narrative of like, oh, if you have hair loss, just go to this place. This with the you got the guy, the Logan Paul guy who had a hair transplant. He's a millionaire and he had a hair transplant at a hair mill.
Doesn't make
Uh
sense.
yeah, you have, the Francis Ngannou, even Akon talked about going and paying $6,000 in Turkey for a hair transplant, and his hair looks not good. So it's like these guys, you have millionaires that could go anywhere in the world choosing to go to a hair mill. That sends a message to the masses like, okay, well, because people just believe, oh, because they're famous or they have all the money in the world, they must be doing something right. They must be making the right choice.
Yeah, it normalizes to the mass population.
Yeah, yeah. And combating that is very difficult to do. A lot of people question, what should a doctor do? What should a doctor carry out in the procedure? I just want to know, how does the procedure, like if I were to go to your clinic,
Yes.
what should I
Okay.
expect
Yeah.
from the beginning to the end?
Yeah. So I do the entire procedure. So I do all of the extraction. I have a good team now because I only opened. So I work for a large company, and then I separated myself and started my own company in April this year. I have a team with me that helps me do the surgery, but in terms of extraction, I do the entire extracting process. My team helps organize the grafts. So we do organize grafts into one, two, three, four hair follicles. And then in terms of implanting, I do all the implanting too. So the girls, how we do the implanting, we do them with implant pens.
Oh wow. So you
So
do all the implanting too? You do the
I do all,
extractions and the implanting.
yeah, big days.
Wow, jeez. So those like 8,000, those 4,000, 5,000 grafts, how long
Or
is that taking you?
depends on the case. So sometimes, say, extraction will take 3 to 4.5 hours. Implantation will take 4, 5 hours.
Mm,
The bigger cases.
yeah. So
Yeah,
about 10-hour day
yeah,
usually for those big cases.
yeah,
That's actually not too bad
yeah.
considering like the number of grafts. So you're extracting a good number of grafts per hour. You're getting good.
Over 1,000. You could go faster. So there's a line with doing it fast as well. If you go faster, what I find is your quality goes down. So there's a
Mhm.
sweet spot for each head.
Oh, okay, yeah.
Try to get to that spot where
A
the quality,
balance.
there's a balance. So
Yeah,
where the speed and the quality matches. So you don't want to go too fast and damage the hair follicles. One of the topics that I'm strong about is using medication
okay.
with hair transplants. I think
Okay.
a lot of people nowadays do promote medications, but I think patients need to be aware, especially if they're getting a hair transplant done, they need to consider using medications. Reason being, you can look great after a hair transplant for 12 months, but what's going to happen in 5 years, 10 years plus? They're things people need to consider because you don't have an unlimited number of grafts at the back of the head.
Absolutely. Medication is absolutely crucial. I'm a big proponent of topical finasteride, topical dutasteride,
Yeah,
oral finasteride, oral dutasteride if you can, if you don't get side effects. I'm a huge proponent of oral minoxidil. It's been working really great for me. Topical minoxidil is not as effective, but still better than nothing. I mean,
better than nothing.
if you want to take topical finasteride and minoxidil and call it a day, that's better than just doing nothing or just trying to take a biotin or something like that, which is not going to work. Thank you for joining the podcast. It's been a pleasure. I can't wait to see more of your work. All right, buddy, take it
Thanks,
easy.
Melvin. Have a
All
good
right.
day, mate.
Bye bye.
Bye.